Okay, good afternoon, class. My name is Cale Watkins. And before we start, I want to ask two questions. Does anyone know what this word on the board is? Does anyone know what it is? How to spell it? No? Okay. I mean not that. But okay. All right. Shh. I didn't know how to do what this was either before I learned all this information. Before we start, I want to tell a story about Earl from Petco. Earl, on his first day, he walked in all confident, happy, and then they gave him the pooper scooper job. He's like, this couldn't be that bad. What can happen from picking up poop? Little did he think that you could get a disease. One day he was working, picking up poop, and then wham! A friend slammed the pooper scooper in his face. He thought it was just a joke. He went home. A couple days later he had a fever. Little did he know, he had just contracted the disease, silicosis. Overview. In this presentation, I'm going to talk about the history, diagnosis, transmission, symptoms, effects, treatment, prevention, and experiment. So first, let's start with what is silicosis. Silicosis is a zoonotic infection. This means that it can be transmitted from animals to humans. And it is Chlamydia fusariae is a bacteria that it is. It's a rock-shaped gram-negative bacteria and can be transmitted from parrots to humans. History. Silicosis was first introduced in 1879 in Europe, whereas it was introduced as a human disease. It was first introduced in America in the 1929 Christmas trade when parrots were brought over to America on shipping. This pandemic caused America to shut down its borders, and the city of Los Angeles had a breakout of silicosis. Diagnosis. To diagnose silicosis in humans, one must take several blood tests to see if the bacteria is in their blood, and they must take an antibody test. What an antibody test is when the doctor searches your blood for antibodies to see if it has an antibody that fights against the antigen silicosis. Transmission. Yeah. Transmission. This disease is transmitted by inhaling dried bird dropping secretions or from feathers of infected birds. This disease cannot be spread horizontally, meaning through human to human. And the disease comes from coming in contact with a wild parrot. Symptoms. Symptoms in birds include eye discharge, swelling of the throat area, hard breathing, diarrhea, poor appetite, lethargy, which is basically skin lesions, and weakness. Symptoms in humans include flu-like symptoms, fever, chills, nausea, vomiting, muscle and joint pain, diarrhea, weakness, fatigue, and dry cough. Rare case symptoms happen after 2 to 4 months if the disease is not treated. What happens is inflammation of internal organs, which includes the heart, brain, and liver. For treatment in humans, common antibiotics such as tetracycline, chloramphenicol, doxycycline, are used. Doxycycline is used when the patient is severely ill and have not been treated after 2 to 4 months. This antibiotic is injected right into the vein of the patient for the best health results. If symptoms have not reduced in 48 to 72 hours, a relapse occurs, and the treatment should go on for 5 to 10 days. For treatments of birds, doxycycline, oxytetracycline, and chlortetracycline should be used. Treatments of birds, the drinking water doxycycline should be put into drinking water and weekly injections for 6 weeks. Injecting the doxycycline directly into the arm is the best way to treat the parrot because it gets to the system faster and there's no mishaps that can slow the treatment from going. Calcium supplements should also be should be taken out of the diet of the parrot to make sure that it heals faster. Two mortal cases of psittacosis in the past years is one of a 69-year-old woman, which happened in December 2005. After coming home from a 3-week fever, she was taken immediately to the hospital. She was put into intensive health after PCR testing, but she tested positive for the antibody of psittacosis. After treatments of doxycycline and tetracycline were injected in her arms immediately, after 3 days she died of respiratory failure. In 2008, a 48-year-old woman was put into the hospital of developing respiratory failure. After 3 days of treatments, she died of multi-organ failure. Experiment. In my extract, five doctors did an experiment on 9 male Westar rats, testing bacteria Chlamydia adulta on the rat mice. This bacteria is a gram-negative, and 4 lab rats died. Material method. They used 9 male Westar rats and parasitic testing, which basically tests the amount of parasites in the blood of the rats. They tested for microscopic lesions, which basically is the smears of the parasites on the cells of the infected rats. Smears of the vital organs were stained for microscopic examination. Uninspected cell cultures were used as the control of the experiment. Material and methods continued. Cover slips were fixed after incubation period of 48 hours of gram staining. PCR tests were conducted on samples of the heart, spleen, and kidney. And a PCR test is a polymerase chain reaction test, which tests how the bacteria reacts to the kidney, the spleen, and the heart. For DNA sequencing, DNA bands were extracted using DNA gel extraction kit. Results. The gram-stained smear of the bacteria showed massive infection with trichomonas. Intracellular infection can be shown growing 8 to 12 days after infection. In discussion, the scientists gave a report of the lab rats with the psittacosis. The bacteria was isolated and PCR tested, and post-mortem tests were conducted. Post-mortem tests are basically when it's like an autopsy for a rat, and they examine the cells of the rats and how they were infected with a parasite. In conclusion, today we talk about the history, diagnosis, transmission, symptoms, effects, treatments, prevention, and an experiment. Now back to Earl. Earl sadly was in the hospital for 6 months. Although he didn't die, because no one dies in America to psittacosis, he did have a bad rest of the year of school. And remember, don't play with poop or you'll infect the group. Thank you. These are my citations. This concludes my presentation.
Guys, hands. Questions for Cale?
Yes, Chris.
Alright, so I just want to kind of get something cleared up. So the only way to get the psittacosis is for you to touch poop from a bird that is infected with it?
Yes.
So is it very common or no?
No. It's a very rare disease. Yes, mommy.
Is only affected through bird feces.
And the feathers of an infected bird.
So no other animals.
Yes, Walter.
So for the symptoms for birds, when you say like eye discharge, like the eyes really like just pop out, the eyes pop out.
No, a white thick substance comes out from the eye.
Oh, okay.
Yes, it do.
You said that you mentioned that the birds that usually get the disease is parrots, right?
Yes.
Is there any other possible species?
It was before called psittacosis by the bacteria. It was called parrotfield because that's the only known bird to transmit the disease. Yes, sir.
About how many people a year get this disease?
I have to do further research to answer your question.
Oh, okay.
Yes, next.
You said something about taking the calcium out of a bird's diet. So when you were like talking about the birds, do you mean like people have these birds? Like pet birds?
Yes, pet birds.
And so they get the disease. Okay.
Yes, Walter.
Does this disease affect birds more or humans?
I would say it infects birds more because they don't. When they're infected, the owner often doesn't know if they're infected, so they don't know if it's treated, when to treat it, or how to treat it.
Okay, jazz hands.